Simon's New Era. That plan will create 105,000 new jobs. This will happen through an injection of 18 billion euro of new money into the Irish economy. This money will be raised from private equity, from sale of state assets, and from investment by the European Investment Bank. These jobs will be in renewable energy, in water supply, in broadband, building new networks, building new infrastructure for the new economy. They will be delivered within Fine Gael's first term in government, and they will provide real opportunities for all people, no matter what their age and no matter what their trade or their qualification. In order to deliver on this jobs policy, we must address what has been the most catastrophic legacy of this government. Do you remember when you were promised that the government's banking plan would fix the banks and get credit flowing to protect jobs? Of course you do. Do you see any evidence of that? Of course you don't. They've been bailed out 3 times already. 3 times. And now they want further sacrifices from taxpayers and mortgage borrowers. Unless there is a change of government, the banks will get what they want. Because as you know, there is no limit to what Fianna Fáil will do to protect their powerful friends. Did the Taoiseach protect their powerful friends? Did the Taoiseach not say that whatever cheque is required will be written? And as you know, cheques written by Fianna Fáil come out of your pocket. Well, Fine Gael has a fundamentally different approach. Firstly, we will not borrow further billions to bail out Anglo-Irish Bank again. We will use that money to start a new state national recovery bank. It will get credit flowing quickly to protect jobs and to support business. And secondly, there will be no whitewash. The current secrecy will not be tolerated. We will carry out a rigorous and open investigation to find out exactly why the banking scandal happened. We will hold people responsible even if they are ministers, and we will open their books. There must be a clear message, a very clear message to bankers. They will never be allowed to destroy our economy or our country again. Those who broke the law in pursuit of greed and reckless lending must face the consequences, and if the courts decide, they must be sent to jail. A responsible society takes care of its people when they are sick. We have doctors and nurses who do heroic work, but the fact is that they're trying to care for people in what I call a maelstrom of unmanaged misery. I am not prepared to pour more and more taxpayers' money into a failed bureaucracy that has lost touch with its core mission. You don't have to read headlines about Tala Hospital. The suffering is all pervasive, as is the fear. I mean, what kind of country are we living in when people are frightened of having to go to hospitals that are supposed to care for them? Fine Gael will not tinker around the edges of this failed bureaucracy. We will deliver revolutionary change in healthcare. We've examined the best health systems internationally. And we believe that the Dutch system, which is ranked number 1 in Europe, is the best suited to Ireland. This system works for 17 million people every day in the Netherlands. We will make it work here for our 4.2 million. It will bring improvements that patients will see, that patients will touch, that patients will hear, and that patients will feel. Dr. James Riley's Fair Care plans will put an end to waiting lists. You will have a really strong primary care system. You will see hospitals run by local trusts. You will see hospitals value patients as resources, not as obstacles. You will see an end to the 2-tier system, and you will see everyone treated based on their medical need and not what they have in their pocket. This plan will include free GP visits at point of delivery, and it can be delivered within existing budgets within the health system. Let me tell you how it will work very simply. Under Dr. Riley's Fair Care plan, the money will follow the patient. The hospital will no longer get an allocation of money to spend as it chooses. Instead, in future, each hospital will be paid per patient and per procedure. This means that if you are a consultant, you will not be paid until you have read the GP's letters and have responded to them. The X-ray department will not be paid until the radiologists there have read the X-rays that they are supposed to have read. That is how it will work when money follows the patient. So everything in Gael's plan focuses on fairness and on paying attention to the needs of people, not on protecting the system. We listen to people. We do not play with statistics.